next we are going to talk about different stages of anesthesia. Stages of anesthesia. Now, during administration of anesthesia, the receiver goes through different stages of behavior, ultimately leading to unconsciousness. So, this process is accelerated with IV anesthetics, and so much so that that is negligible to consider during their use. And the 4 stages of anesthesia described using Gudel's sign, signifying the depths of anesthesia. These stages describe the effects of anesthesia mainly on cognition, muscular muscles, and respiration. So firstly we will try to understand what are the 4 phases. Okay, so phase 1 of anesthesia is known as analgesia, or the stage of analgesia. Now with this stage you might be aware, as the word suggests, analgesia means यहाँ पे the pain stimulation starts to abolish, or the pain is progressively abolished. The pain progressively abolishes. Next is the stage of delirium. Now we are going to study all these stages in detail, but I'm just giving you like a sort of summary so that you know what stages we have to go through and study. Third is stage of surgical anesthesia. Surgical anesthesia. So it is again subdivided into 4 phases, that is plane 1, plane 2, plane 3, and plane 4. What happens in these phases we will discuss in length. And then finally there is the last stage, which is known as the stage of medullary paralysis. So we will begin by discussing the stage of analgesia. Now, it starts from the beginning of anesthetic inhalation and lasts up to the loss of consciousness. Okay, so you administered what? Let's look at this time frame that you administered the anesthesia. So suppose you are giving your patient a inhalation sort of inhalating anesthesia. So it is the beginning. This stage starts just when you have administered the anesthesia till the person has lost the consciousness. So within few seconds or in a matter of time, the person will lose the consciousness. This is your stage of analgesia. ये आपकी stage of analgesia रही from here to here. So pain is progressively abolished. Progressively abolished means they have mentioned the word progressively abolished, means धीरे धीरे करके slowly the pain will start to like dial down, like from a scale of 10 it will go to a scale of 0. The patient remained conscious, can hear and see things, and feels a dream-like state. Okay, so consciousness chala gaya hai, although the patient still can see and hear things, so it is a dream-like state. Dream-like state, as he can still hear or see things. And amnesia develops by the end of this state. So as the loss of consciousness is reached, also amnesia develops by the end of this stage. Okay, now through some minor operation, though some minor operations can be carried out during this stage, it is rather difficult to maintain. Use is limited to short procedures. So you can, because it is difficult to maintain this stage for a really long time, therefore it is used only for short procedures. And what can those procedures be? Those procedures can be labor, or you're doing some kind of incision, or some minor operations. So in this case you can use this is the stage 1 of general anesthesia. So the receiver of the anesthesia primary feels analgesia followed by amnesia and a sense of confusion, moving on to, so in the dreamlike state you can also write confusion. So these are the stages of general anesthesia. This was a stage 1, also known as analgesic, stage of analgesia. पॉइंट पढ़े यहाँ पे, पहला पॉइंट हमने पढ़ा दैट स्टेज ऑफ एनाल्जेसिया इज नथिंग बट द बिगिनिंग ऑफ inhalation of anesthesia or the administration of anesthesia till the loss of consciousness or the beginning of amnesia. Okay, so the pain is progressively abolished in this stage. Okay, and the person is in a dreamlike state or confusion stage where sometimes they can still hear or see things. It is difficult to maintain this stage of analgesia, therefore it is used only in short procedures where you have to maintain it only for a shorter period of duration. Right, now the stage of amnesia develops at the latter, like by the end of that, they said that the amnesia develops by the end of this stage. So 4-5 points you can write the answer. Now the next is your stage of delirium. Stage of delirium. Now delirium means what happens in this phase is that ये phase start होता है since the loss of consciousness. So following the loss of consciousness in stage 1, so ये stage start होता है loss of consciousness से till what, till there's no end, there's no predefined end to the stage, like you don't have a particular word to like say okay this is the end of the stage, but basically the person is characterized by, because how it would be a better word, we'll look at it. So loss of consciousness, the person is unconscious now, the person has lost his conscious, they will do some delirious activity. So these are characterized by what? These are characterized by excited and delirious activity. What are those? So this is unable to think or speak in a sensible and reasonable way, usually because obviously you are under anesthesia, so you are not able to speak in a sensible tone. So breathing and heart rate becomes erratic, you have nausea, you have pupil dilation, and breath holding might occur, and because of this irregular breathing and risk of vomiting, there's danger of choking. And in such stages the surgery or any sort of surgical procedure in this stage 2 is not performed, because of the same reason that the person is in a very sort of fluctuating stage. Now modern and fast acting drugs, they aim to limit the time spent in stage 2 of anesthesia. So from loss of consciousness to the beginning of regular respiration is what we can say is stage of delirium. Okay, now the patient obviously would become excited, so there is apparent excitement is seen in patient, they may shout, you may also see them struggle or hold their breath. So these are what the characteristic of the patient seen in stage 2 of general anesthesia. There is muscle tone is increased. Okay, muscle tone increased, where jaws are tightly closed. Breathing is jerky. Vomiting can be there, nausea can be there. Then involuntary micturition or defecation may be seen due to sympathetic stimulation. So these are all what? These are the characteristics seen in a patient in stage 2 of general anesthesia. Now no stimulus should be applied or operative procedure carried out during this stage, because this stage is inconspicuous in modern anesthesia. So this was all about stage 2. So the next stage that is say stage 3 of general anesthesia, is the stage of surgical anesthesia. And what is the duration of this phase? Like, how does it begin? It begins with the onset of regular respiration. Do you remember in the previous phase, that was the stage of delirium, the end stage was what? Beginning of regular respiration. So here the onset of regular respiration to the cessation of what? Cessation of spontaneous breathing. So muscle relaxes, breathing is depressed, vomiting stops, eye movement slow and then cease. So the patient is ready to be operated on, and hence why the name of the stage where you actually do the surgery, or you actually do the surgical procedure. So this has been divided into 4 planes. As first is plane 1. So plane 1 में क्या होता है? In plane 1 there is roving eyeballs. This plane ends when eyes becomes fixed. So ये प्लेन स्टार्ट कहाँ से होती है? रोविंग आईबॉल्स, आपकी आंखें ऐसे रोव कर रही होंगी, आईबॉल सॉरी, एंड देन इट एंड्स विथ व्हाट? इट एंड्स व्हेन द eyes become fixed. So this is plane 1. Then what is plane 2? Plane 2 is loss of corneal and laryngeal reflexes. Corneal और laryngeal reflexes का loss हो जाना is what counts for phase 2. Then there is obviously plane 3. Plane 3 is pupil starts dilating and light reflex is lost. So what happens in plane 3 is your pupils start to dilate. Okay, these are your pupils and they have dilated. So pupil starts dilating and light reflex is lost. Then comes plane 4. Plane 4 is nothing but intercostal paralysis. Okay, shallow abdominal respiration and dilated pupil. Intercostal paralysis, shallow abdominal respiration and dilated pupil. As anesthesia passes to deeper planes, progressively the muscle tone is decreased. Okay, the BP falls. So इसके बाद भी जैसे जैसे anesthesia deeper से deeper plane में progress करती है, muscle tone जो है आपका muscle tone decreases, BP falls, then heart rate is increased with weak pulse, respiration decreases in depth and later in frequency also, and thoracic respiration lags behind abdominal respiration. So this is your surgical stage of anesthesia, जहाँ पे actually में आपका कोई भी surgical procedure is done. So let's revise it. It starts with the onset of regular respiration and it ends with the cessation of spontaneous breathing. It is divided into 4 planes. So those is, first plane is roving of eyeballs till the eyeball becomes fixed. That is the end of plane 1. So eyes roll and then they become fixed. Eyelid and swallow reflexes are lost and you still have regular spontaneous breathing. Now in the plane 2 you have lost your corneal and laryngeal reflexes. They are lost, right? And then plane 3 is nothing but pupillary light reflexes is lost, and this process is marked by complete relaxation Okay, complete like this pupil dilation. Okay, so this is the ideal level of surgery in ideal stage of surgery. um, right, this is ideal level of anesthesia for most surgery. Then in plane 4, the diaphragm paralysis occurs. There is irregular shallow abdominal respiration. So the intercostal paralysis is there, shallow abdominal respiration, obviously dilated pupil abhi bhi hai, and the muscle tone decreases, the bp is fall, heart rate increases, but uska jo pulse hai wo weak rehta है, and then respiration decreases. So this is your stage 3, which is also known as surgical anesthesia. The skeletal muscle relaxes, vomiting stops, respiratory depression and cessation of eye movements are hallmarks of the stages. The patient is unconscious and ready for surgery. Now, let's move on to the next stage, that is stage 4, also known as medullary paralysis. Again, as the word says, this stage is the stage where there is paralysis of what? The medulla. So medulla oblongata, or simply medulla, is a long stem-like structure which makes up the lower part of the brain stem. Okay, and then it is responsible for what? Autonomic functions. It is responsible for what? Autonomic functions or involuntary functions, like what? Vomiting or sneezing. Right, vomiting or sneezing. Again, it is medulla that contains the cardiac, so related to heart, respiratory and vasomotor centers. So anything that happens to this stage, anything that goes wrong with medulla will impact the heart rate, will impact the respiration, will impact the vasomotor centers, and therefore it deals with autonomic functions like what? Breathing, then there is heart rate, then there is blood pressure, as well as the sleep and wake cycle. Medulla is what it is responsible for. So in medullary paralysis, stage 4 is also known as overdose. So overdose, what? This is basically, if this stage is there, if you are observing this stage, it means it's death. So this is also known as overdose, occurs when too much anesthesia is medicated to the patient during the surgery. Okay, and the patients has severe brainstem or medullary depression. So the patient has medullary depression. इसमें क्या होता है? रिजल्ट होता है, इट्स रिजल्ट इन सीजेशन ऑफ व्हाट? रेस्पिरेटरी and potential cardiovascular collapse. So there is cessation of respiration and cardiovascular collapse. So this stage is lethal without cardiovascular and respiratory support. So if there is cessation of breathing to failure of circulation and death, pupil is wildly dilated, बहुत ज़्यादा dilate हो जाते हैं, बिल्कुल wildly dilated pupils. Muscles are totally flabby, pulse is thready or it's very faint, and the bp is very low. So what is happening here? There is cessation of respiration and cardiovascular collapse. Why? Because you have your medullary paralysis. So these are the 4 stages of general anesthesia.